Good morning. If everyone can go ahead and start taking their seats, we'll get started in just a moment.
Where's the mayor today, Preble? Preble?
He's on a fishing trip.
If he's on his own boat.
So y'all are stuck with me. Okay, great. I want to thank everyone for coming this morning. We are going to go ahead and start off with the call to order, and we don't have anyone here, I don't think, to do an invocation, so we'll just go ahead and go right into our Pledge of Allegiance. Mr. Marler, if you'll lead us. Mr. Overdeer?
Ladies and gentlemen.
Okay, so once again, thank you all for coming. You'll see that we did take advantage of the social distancing and have everyone spread out, and are glad you were all able to attend, though. This is a very important meeting, and it's great to see so many faces here. We're going to go ahead and start off this morning with Dr. Karen Chapman. She had a presentation that she did for the Okaloosa County Board of Commissioners yesterday morning. It seems like 100 years ago, but if she could go ahead, I believe, isn't this Dr. Carpenter? Dr. Chapman, where did I get Carpenter from? So welcome. Well, no, I apologize for calling you Karen Carpenter. And press that red button. There we go.
Okay. Let me look. I'm sorry. If you, I guess I'm the only reason you've got this all together here. All right. Well, this is not making me happy that my presentation is gone. So I apologize. And I'm to tell you that having all this on the top of my head is. So if you could just give me a moment, I apologize.
Oh, absolutely.
Don't know
I think we're all a bit flustered as we come together and try to figure out the best path forward for everyone. Lance, did you have any opening words for everyone before we get started as city manager?
No, I just appreciate council taking the time to come in for a special meeting. This is a very important matter that we need to get addressed. Appreciate members of the public who were able to attend. Appreciate the people who decided that it would be better to watch this on YouTube and protect all the rest of us who have to be here in person. So we have a few things to present to council after Dr. Chapman makes her presentation to help mainly with our staff and the operations, and we'll get to that as soon as Dr. Chapman finishes up.
All right. It's there.
Thank you.
Buried. Okay. Good morning, Mayor Ramswell and City Council members. I appreciate the opportunity to speak with you. On March 17th and 19th, I presented to the Board of County Commission. It's been 24 hours since I made that last presentation. So let me give you a little perspective of what we're dealing with. On March 4th, March 4th, 2020, there were 158 cases of coronavirus in the United States of America. By 4 p.m. last night, 10,442. And that number has been surpassed with some of this morning's reporting, but the CDC only updates at 4 o'clock every evening. As of yesterday evening, the following states are reporting community transmission of coronavirus: California, Colorado, Illinois, Iowa, Louisiana, Maine, Maryland, Massachusetts, Michigan, Minnesota, Mississippi, Nebraska, Georgia, Nevada, New Hampshire, New Jersey, New York, Oregon, South Carolina, Tennessee, Virginia, Washington State, and Wyoming. And so many states are beginning to see community transmission. On March 2nd, there were 2 cases in Florida. Yesterday, when I presented to the BCC, or Tuesday when I presented to the BCC, there were 160 cases. Yesterday, when I presented to them, at the end of Wednesday, March 18th, there were 328 cases. It had doubled in less than 24 hours. As of last night of 6 o'clock, there were 432 cases. So as of last night, in Northwest Florida, there were 7 reported cases of this virus. I'm sorry, as of March 18th. As of last night, there were 9 in Northwest Florida. That's our 4 counties of Walton, Okaloosa, Santa Rosa, and Escambia. 5 are in Okaloosa. 2 were associated with travel in the U.S. Okay, so we're not talking about traveling overseas or on a cruise ship. 2 were associated with travel in the U.S. This is a novel virus. I know there are people that say, no, it's just a cold. It's not a cold. This is not a virus we had any knowledge of until the Chinese identified it in December, and it was really reported to the world in January. So what does novel mean? It means it's a new pathogen for human beings. What it means is that this pathogen was in nature, it was in some sort of animal, and it jumped from animals to humans. When a virus jumps from any sort of animal species to humans is when it's at its greatest danger to us, because we have different biological makeups. Now, I can get into some detail. If it jumps from a bat to us, it's worse, or a bird to us, it's worse than it jumping from a mammal to us. But nevertheless, whenever it jumps from a species that isn't us, it's a bad actor. So, needless to say, it's only been approximately 3.5 months that we've known about this virus in both the public health and the medical world. So there's much we do not know, and many of the early assumptions have, well, been wrong. We are truly at war with this virus. Initially, everyone really thought, well, really, it's only the people 60 and older who have the greatest risk of poor outcomes, as we saw nursing homes and those nursing home patients and all the deaths that were associated with the one in Washington State. And that is true. The death rate for those 60 to 69 is about 2 to 3%, 70 to 79, approximately 6 to 8%, and over 80, 14%. These are really high death rates for these age groups. And compound those from anyone of any age with multiple and particularly serious chronic medical conditions, those death rates are higher. What was disturbing, and we learned this just Wednesday from a recent U.S. study of adults 25 to 54 that were getting this virus, that they made up 40% of the persons needing to be hospitalized. This is not an age group that's generally hospitalized for when they get a viral infection, influenza, things like that. So this is not just a simple cold. We are not seeing a pattern of a simple cold here. So lots has gone on in the state of Florida since the beginning of this month. On March 1st, a public health declaration of emergency and an executive order were issued. Shortly thereafter, the president declared a national emergency. On March 9th, the governor, prior to the president, had declared a state of emergency. The governor asked counties and cities and other agencies to cancel or suspend mass gatherings. He also issued orders, and these orders have evolved over the last couple of days, but essentially there are no visitors now. That is now an action that's both at the state and the federal level to nursing homes, and nobody allowed to come in there who works in them that has any symptoms of a lower respiratory illness or a fever. Early this month, state government barred any non-essential travel for state employees, no out-of-state travel, and only totally essential travel. Key leadership in all of DOH. Our vacations have been suspended indefinitely. These are kind of actions I'm looking at you all and our businesses to look at in order to minimize the chance of your employees coming in contact with this virus. Numerous other actions have been taken this week, and I know you're fully aware of them. Our state university system originally was just going to be closed for a couple of weeks and do teleeducation. It is now over for the semester, and all will be done through teleeducation. Students will be sent home. They were found to be staying on campus and partying. Obviously, that did not make the governor very happy, and he shut them down. All K through 12 schools in Florida will resume school online effective March 23rd for us through April 15th, but don't be surprised if that changes. Yesterday, the governor in his press conference said he would seriously address suspending the requirement to seek employment in order to obtain unemployment. The U.S. House passed a comprehensive economic bill to address the consequences of this. The bill's now in the Senate, and we're hopeful that the bill will pass out of the Senate and it can get signed by the President. That would be pretty fast action. Nationwide and in Florida, many large events have shut down. Major league sports. If you're a sports fan, this is a bad time to be a sports fan. It's all been shut down. Disneyland closes today and closes all their hotels. Spring training has been canceled, and throughout the state and throughout the nation, many, many festivals have been canceled. The county commissioners declared a local state of emergency on March 17th. They closed lobbies to all county buildings, closed the convention center through the end of April, and revoked all granted event permits through the end of April to reduce the number of people coming here and the number of people congregating. They also, too, implemented no non-essential travel or training. All directors were advised to not attend board meetings unless they had business before the board. They instructed them not to attend any meetings, and they gave administrative directives to their employees about the use of leave for the purposes of sickness, to care for an ill family member, or issues related to needed child care if schools are closed. On March 19th, the BCC closed all beaches, starting tomorrow through April 30th. Walton BCC actually was a step ahead of us, but just by maybe 30 minutes. Many private entities in Walton County are closing their beaches. Seaside is an example. The goal of stringent social distancing is reducing the number of people who are interacting with each other. The goal ultimately is to reduce the number of cases, reduce the number of serious cases. It's called flattening the curve. The diagram can be a little misleading because it makes you think, okay, let's just have a whole huge surge, get it over with, and then it'll be gone. Well, that's really talking of this huge surge. It's more about having all those cases at once. It doesn't necessarily mean it's just going to end sooner. What it means is that it'll go up, and then if we don't do anything to control it, it'll just keep going on and on and on. We want to flatten that curve and reduce the number of people who are getting sick. But I tell you, even flattening the curve will be stressful on our local healthcare system. But there's a big difference between being stressed and overwhelmed. Already, our hospitals, our nursing homes are seeking collection specimen kits. They're seeking masks. They're seeking gowns. And we are in competition, not with just other parts of the state, not with the nation. We are in competition with the world to get these supplies. Hospital beds, this is influenza season, are already pretty maxed out. And so the real goal here is to try to reduce infection and keep people healthy by keeping them apart. I went to bed last night with the state of California going into complete shutdown. Complete shutdown. So, some may say, oh, Dr. Chapman, you're just full of hyperbole. I wish I was. These are facts that I'm putting out before you. And I ask you to heed the words of Michael Levitt. If you don't know him, he's the former Republican governor of Utah, and he was the secretary of HHS, Health and Human Services, under President Bush. And he recently said, everything we do before a pandemic will seem alarmist. Everything we do after will be inadequate. The world is in a pandemic. We haven't had a lot of cases here yet, and you may say nothing to worry about. But it is. I can tell you the number of cases coming in positive are coming in more per week than 3 weeks ago. I really encourage you to take whatever actions you can take today as a city to blunt the effect of this virus locally. And I regret to say that, to a large extent, spring break is non-essential travel. And our own president said, stop it, stop taking non-essential travel. And we need to listen to that because I'm afraid we'll get overwhelmed. Now, just to let you know, when I get a case, that doesn't end for us in public health. We do something called contact tracing every day. Most of the time, you never see us do our job and deal with outbreaks in this community because we contain them, we mitigate them. We deal with them all the time. We deal with them in nursing homes all the time. This is the time you're seeing us at work. And when we get a case, we do a deliberate process called contact tracing. And we identify all of those people who have spent time, and we try to determine the length of time, because the more exposure, the more opportunity to share the virus. Within 6 feet, having close personal interactions, and people who have spent time with them in the previous 10 days to 2 weeks before they were sick. We try to figure out all of that, and then we contact all those people. And in this day and age, that is not easy. People don't answer their phones for telephone numbers they don't recognize. We leave messages. It takes days sometime to track someone down. We put them into self-quarantine. It's called quarantine when you are asked to stay away from others and you are well. If you're sick, it's called isolation. We put those people into self-quarantine for 14 days from their last exposure, and we monitor them, and we're on the phone with them, and they're taking their temperature, and they're monitoring their symptoms. If they get sick, we bring them in and we test them. So there's a lot of work. One case had 53 contacts. Those are tough. So I can't keep ahead of this if we keep mingling people together in our community, in our lives, in our churches. You know, I'm hearing that more of the grocery stores are giving an early hour, at least a couple times a day for people over 65. Thank goodness. That's when the store's its cleanest. So that's where I'd like the elderly to go, is to those stores that offer that opportunity. We're all in this together. This really isn't just a public health crisis and a medical system crisis. This is a crisis for all of us. None of us in our lives have been asked to sacrifice for our community or our country. But right now, we are having to ask for you to sacrifice for all of us. We can, contain and mitigate. If we can break the train of transmission between people to people, this virus, well, we don't know exactly how long it lives on different and various surfaces. If we take away its favorite host, human beings, for transfer, if we keep people apart, we can break it. But we can only do that if we intensely implement what many are saying is really stringent social distancing, because there is no medication. There are trials going on, but there's no medication right now available to treat this. All we do in the hospitals is supportive care. That's it. There aren't enough ventilators in the country. Absolutely they're not. There really aren't even enough hospital beds, because most of our healthcare system is for profit, and they live on the margins just like everybody else. And I'll be honest, and I told the commission yesterday, we haven't been hit hard. We might have a chance here to blunt the effect, but the hours are ticking by quickly. They're ticking by quickly. And so stern action is needed now. If we can blunt it here, we might be able to get through it with our own medical system. But if we don't, and if we can't, I am very fearful that the country will run out of assets. And even though Governor DeSantis said there are 3 mobile hospitals, and these are terrific assets in the state, they're probably going to all be used up by the time we need them. So I implore all elected leadership, all community business leadership, to take this seriously. Because once you crush the medical care system, many, many, many more people are going to die from this. Thank you.
Thank you so very much for this really important information. And I actually watched your presentation yesterday, and I feel like you gave us even more insight and some additional information, which is
everything evolves by the hour. I had more to give you.
No, for sure. And I'm sure there's going to be some folks up here with questions. I did have one that I wanted to open with, and it's one that I had thought, well, my daughter's stuck at home. We live at the beach. No big deal. We'll just go hang out on the beach, go swim in the salt water, which is so healing in itself. But I'm hearing, and clearly at the Okaloosa County Board meeting, it was said that going to the beach and being in the open air is really not helpful.
So,
can you explain specifically why?
This is specifically in reference to the whole spring break issue. You know, would I love to say, is it, a big debate on it yesterday, closing the public beach accesses. The problem is, and that means our residents too. I wish there was a way to do this, that we could allow those of us who live here to do that, to go to the beach. I don't know what kind, putting systems in place to give people permits and stuff, but then how would you make sure that no gatherings of more than 10 got on the beach? It got very, very complicated. being outside is fine. And, you know, taking a walk on the beach doesn't put you at risk. What puts you at risk is being on the beach with hordes of people. And then, how do we do our contact tracing? You know, I think about a spring breaker coming down with this while they're here, and I was like, well, who have you been around since you got sick? Well, I don't know. You know, I mean, they're partying out on the beach, they're drinking or getting drunk before they come to the beach. We're never going to be able to find those contacts. We're never going to be able to isolate and contain. It's not, now I will also caution, because you gave me an entree for it, our waters are not healing for everybody. Salt water is a natural body that has organisms in it. And last summer we dealt with Vibrio vulnificus. It is not a healing water. If you are elderly, if you are a very young child, if you are immunocompromised, and you go in, even with microabrasions on your skin, and you get Vibrio vulnificus, you can be very seriously ill and die. So I don't want people to think that that. It is a natural body of water, and there are risks associated with a natural body of water when you go into it. It's not a highly regulated pool. So yeah, it's a conundrum. I agree entirely.
Yeah, no, thank you for addressing that, because that, like I said, that was my first thought. Well, no big deal. This is what we'll do. And I know others, especially people that grew up around here, going out on their boat, you know, whatever, same thought. So thank you for
I think people
clearly
go out on
addressing
their
it.
boats. I just wouldn't go out with a large group of people, and I certainly wouldn't go out with a bunch of people I don't know who
On a
they are.
charter or something.
Yeah, I
Yeah.
wouldn't.
Wonderful. Okay, Council, let's turn to you all and see what questions, comments you might have. Does everybody tend to have something and we can just kind of go down the line, or?
I think you pretty much answered all my questions, but thank you so much for being here this morning.
Okay, thank you.
Thank you, Dr. Chapman. I have been listening to your speeches and your presentations since you gave the school board. And we spoke this week, and I appreciate your time on that. Each and every time you spoke, it's getting progressively worse, sadly, okay? I had that quote from Michael Levitt. I was going to quote you, so you already took care of that, but I thought that was well said. I've done some due diligence, because a couple of things you didn't say today, and I've watched everything. You didn't use the word "people will die" today. You used that a lot yesterday, because it's true.
Yes,
okay?
people will die.
Absolutely. And the biggest thing that I did, okay, you know, we talk about resources, okay? Our own, if you will, playbook, our strategic plan here. The number one thing talks about our year-round residents. That's our number one priority, our residents. You start thinking about if your husband or your wife or your mother, your daughter, whatever gets sick. Like you said, hospitals can quickly get overloaded. I did a review, and I contacted the local hospitals, okay, myself, because I wanted to get an inventory. And I'm giving approximations, and I'm not going to identify the particular hospital numbers just because. But it includes all the south area. I didn't do the north Okaloosa, okay, to include Eglin. But right now, there's approximately 65 ICU beds in total, okay? And there's only 33 ventilators, okay? That is an additional 15 at another hospital that's coming online. But when you start thinking about that, that's certainly not enough to even cover our own people.
Right.
Okay, that's number one. I watched a bunch of college kids yesterday, spring breakers. I got pictures, you know, if anybody wanted to see them, but they're walking together, they're sharing beers, they're opening up doorknobs. And the other thing that you said yesterday that was so important is the travel from locations, okay? When you put up that graphic yesterday of the hot spots, a lot of the places that people typically, that we count on them getting in their cars driving here, those are the areas that are exploding. Okay, so they're coming here, and they potentially could infect us. And that's what you're saying. We're trying to you know, stop that. And so I take it very serious, and obviously we're in an emergency situation. It's not the time to panic, it's just the time to do the right thing. And certainly we can be infecting each other, but if we can limit some of that outside influence, that'll go a long way. And the other thing you said that's critical, in my opinion, is that contact information. You know, if I have it, then we can maybe possibly review who I did. Sheriff Ashley said something yesterday that was the first time, and I'd heard it, but a deputy made contact with an individual who has died.
Yes.
Okay, so you think about that. That deputy, he's self-contained right now, and he's okay.
He's been cleared.
Okay, which is great. Okay, but God forbid if he had been infected, how many people did he contact? And on and on and on. So those are the
That's
things we have
correct.
to think about.
It would have started the contact, and if a contact of a case comes down with this, then contact tracing starts all over again.
Absolutely. So the biggest thing I look at is that obviously, whether we have students or spring breakers come or not, we certainly can have infected people here, and we can certainly each other, but take away that outside influence. I have a couple of quick questions as well, ma'am. First of all, I know you talked about the genesis of this was an animal, okay, believed, okay. Could it be used as a vector with insects right now?
No, mosquitoes do not transmit this.
Okay.
No, it's not transmitted by insects.
Okay. And the other question I had is, and I know this is kind of premature, if you will, because we're not even testing in some cases, but is there going to be a test that would identify that a person had it and didn't even realize it and has survived, like an after-the-fact test?
There is right now a company doing what's called an antibody test. I don't know. I don't know a lot of details. You know, unfortunately, I don't know everything that's going on in the development world, but they yesterday talked to us about a company that was developing an antibody test. Not to get too into the weeds with immunology, but I suspect this is what's called an IgM test, and that's the test that shows acute infection. Unfortunately, it takes several days for your IgM response to bump up, and so it would not be good as a point of care test, which would allow us to diagnose someone who's presenting initially with symptoms. There are other manufacturers, and FDA is significantly lessened the rules to get things through and approved. The big problem is even though they may be getting approved, the ability of that company to manufacture in the volumes that we would need. Let me give you a perspective. It is estimated, and this is not testing, but it is estimated that we will need at least 3.5 billion N95 masks, the masks needed by healthcare providers to take care of persons sick with COVID-19. In the United States, we only produce 1.5 billion a year. So recognize that a lot of these new things coming online, it's great, but ramping up production and being able to spread it out to healthcare providers to serve a population of over 300 million people is really going to be difficult and long-term.
Thank you. I have just one other comment, and again, thank you for your time. Sheriff Ashley said something else yesterday that I paid note to, and it's common sense. We have Chief Sasser here. Different departments have mutual aid agreements, okay? And if there's a bad fire, he can call other departments and stuff like that. You can't call for help because the people you're calling are just as taxed as you, and that's something we have to keep in mind. Our mutual aid thing, we can't call Walton County and say, can you help me? We can't call this county because they're just as short as we are. And that's important for everybody to understand.
Yeah. Yes.
I appreciate your time.
Yes, thank you for recognizing that. We have taken some actions over the years in Okaloosa County to assure that we have a strong epidemiology or disease investigation unit. I will tell you that that disease investigation unit worked with the Sheriff's Office a couple of weekends ago, and we actually found a contact for Santa Rosa that they couldn't track down. But between the help of our Sheriff's Office and my knowing a first name, we found this guy, and that was pretty amazing. You know, it's real detective work. So I knew this was really important work. I also knew it was really important for us to have a strong preparedness unit for public health preparedness. So I can fairly confidently say to you, you have one of the strongest health departments in the Panhandle here for this response. This health department is not one person deep. This health department is incredibly strong. I have three people dedicated to public health preparedness alone. I have 4 epidemiologists. We're hanging in there right now, but you're right, there won't be any help for us. And I'm trying to address, as some of the surge of public phone calls is starting to lessen, about giving staff at least 1 day off in every 7. Because right now, you know, basically, I've worked every day since March 2nd, and, you know, that's my job, but I also need to make sure I and my people stay well so we can stay on the job. And working long days every day, 19 days in a row, just isn't gonna work in the long haul, and we're in this for the long haul. So I do feel that we have a lot of strength here, and some very, very smart people. I feel I'm really glad we made that decision many years ago. It has positioned us well to respond rapidly to our hospitals, to our nursing homes, to our doctors.
Thank you, Doctor. Appreciate it.
Mr. Overdue?
Yes, well, first of all, thank you, Dr. Chapman, for your presentation yesterday, which I think a lot of us probably watched if we weren't there. And your presentation today was obviously very enlightening. A couple of questions for you. I know you told us that the hospitals could very potentially become overwhelmed. At what point are people actually hospitalized?
Usually people are hospitalized when their symptoms are severe enough that they can't stay home. So let's say they're dehydrated. They're having breathing difficulties, and they need, they need IV fluids, they need breathing treatments. That would be more like the hospital beds. Then, if they come in where they need respiratory support, then that's where the ventilators come in, where they can't really breathe on their own. We can give them breathing treatments and we can put them on oxygen in hospital beds. But once they get to a point where they can't breathe on their own, that's when they're going to need the ICU, or if they're severely decompensating with multiple organ failure because of the ravages of the virus, then they would need ICU care. That's when the doctors make those decisions based on the degree of symptoms. And they may also make a decision to hospitalize someone if they live alone and they don't have anyone to take care of them. Some people can be cared for at home and given breathing treatments, but when you're sick and living alone, we don't want you to have to try to figure out how to prepare all your breathing treatments on your own. So sometimes people are hospitalized because they're alone, and they just aren't well enough to take care of themselves without some help.
Okay, thank you. And then the other thing is, and I know the governor said, groups of 10 are what we're trying to limit it to, and you've made reference to that several times, but I mean, why is 10 the magic number? I mean, if you're in a group of 10, I mean, okay, so I'm in there's 9 other people that could potentially still infect me. Is that just because then at least I know who those 9 people are, and if I do get it, I can tell you who they are?
The hope is that by limiting your interactions to people you know and smaller groups of people, that you are less likely to be exposed to the virus. Those recommendations are made like a couple days ago, and things change very, very quickly. For people with chronic medical conditions, who have serious chronic medical conditions, for people 65 and older, I could even say 60 and older, I'd minimize your contacts right now. I mean, I'm trying very hard not to get sick. I'm over 60. And so I know that, we do social distancing at work. We wipe down with Clorox wipes our offices and our meeting room. In our meeting room, we have moved out of my office and sort of the cramped space, and we moved into a larger space, and I tell people to stay apart. We try to keep the room less than 10, but we got to work. We've got to get the job done. So right now, you can move about. So if you're socializing, be darn sure you know. Has anyone traveled out of Okaloosa County in some regards. If you've recently been down in southeast Florida, that's, people can become sick. People are flying in from California. Probably fewer people flying in from California now. People are flying in from Illinois. People are driving, going to meetings in Atlanta and coming home. So know where if you're interacting in any kind of group of 10 or less, I'd know if people have been traveled to any of those hotspots. It's not just international travel and cruise ships anymore. I mean, already the State Department has told Americans quite a couple of weeks ago, you go on, and maybe I'm not remembering the dates all correctly, but if you go on a cruise ship right now, and that cruise ship develops a COVID-19, we will not repatriate you. Can't do it. Really expensive. Very difficult. Forewarned. The State Department also advised against all Americans, against all non-essential international travel right now. I mean, these are not the kind of actions that we take if we don't think this is pretty serious.
Mr. Marler?
Thank you, Mayor Pro Tem. I was diagnosed with Parkinson's 8 years ago. So from the standpoint of a person with Parkinson's or any other muscle diseases, MS and all that stuff, what extra precautions, other than complete self-isolation, what other precautions can patients like that, including cancer, well, I'll just say including cancer patients or anybody with certain medical conditions?
Really, self-isolation or isolation in your home is really, really important for people with the chronic medical conditions. My mother and my stepmother are both over 80. Both have chronic medical conditions, one a heart, one a lung problem. And I have told them to stay home as much as possible, to go to the grocery stores early in the morning. If you go, now one lives in California, so she can't leave her house except to go to the grocery store, the pharmacy, get gas in her car, that type of thing. But I've told my mother, who lives in Georgia, where there's widespread in the Atlanta metro area, I said, if you go to a park, stay away from other people. As you know, and I said, but try to maximize your time at home. So for people with chronic medical conditions, that's really, and yet this is what my stepmother told me. She has a large social network, and everyone's reaching out to her to say, let me go get your groceries. People call more often. She's not too great with FaceTime, so and so that's what I would say to people. Use FaceTime, use Skype to interact with your grandchildren, with other members of your family. But if you do have these chronic medical illnesses and you're over 60, or you're over 60, I would take all precautions you can possibly take to not be interacting with anyone but who you're living in the same house with.
Okay, one more question. A lot of our people around here, well, including myself, most of my work is out in the outdoors. Mm-hmm. And something was mentioned about how long it can stay in the air. Can you give me a little bit on that one?
Oh boy, I wish I had those answers for you, Councilman Marler. This is a lot about this virus we don't know. It is generally with droplet transmission. So you think about when someone coughs or sneezes, that droplet is airborne for about 6 feet. And that's why we talked about 6 feet between people. Ideally, not let anybody come into a meeting or be around you who's coughing. But as far as airborne like tuberculosis, which does float in the air and move with the air, I don't have that answer for you. But the close interaction distance and someone coughing and sneezing, it can transport for at least 6 feet that way. Whether it'll be found to be airborne, There is some speculation, but I haven't seen definitive evidence.
Okay, thank you for coming. Thank you.
Okay, thank you.
Mr. Destin?
Thank you. Dr. Chapman, I didn't get to speak to you yesterday, but I appreciate you taking the time to come see us this morning and for your remarks yesterday. I think it is abundantly clear that we only have so many tools in the toolbox in this early stages of this pandemic to try to mitigate the effects. And our job as local government is to seize what tools we have as quick as we can, given that what we know right now is perhaps we're a little bit behind the curve ourselves as a state and local community. Really, I'd love to tell you I've got a stockpile of masks and gloves and ventilators and beds, but those resources are not kept on hand. As you've said, the private nature of private ownership and for-profit motive of most of our healthcare system operates right at the margins because surplus, having extra beds, extra doctors, extra nurses, extra supplies is expensive and eats into profit. So they operate right at that margin where if they get a glut of need at one point, it spills right over and overwhelms the system, at which point then you have no health care being provided to a lot of vulnerable people, at which point you've got deaths. I think I get it. And so if we only have social distancing as our tool in the toolbox, there is a certain amount that individuals will have to exercise within our own community, our own residents. And what I think has been asked of us through the health department, through the state and others, is to say, how do we keep what is hopefully a lower grade outbreak in a semi-rural northwest Florida county like Okaloosa, that it doesn't become more like Broward County, more like Hillsborough, more like Miami-Dade. And it appears that the only way to do that is to, one, do what we need to do with our own residents, get them on board, but also keep folks from outside from coming in with it. And what I have experienced is there has been a significant reduction in tourism per se. However, it has not been a complete reduction. And I'm not going to go into the anecdotes, but there's a lot of people who are still in the Destin community who are taking their vacations come hell or high water, and there are folks who are going to accept their business and also encourage them to come hell or high water. And that is not necessarily good for any of us here. And so, while I believe it's a crying ass shame to be forced into this situation, I think we have to do what we need to do, which is we need to encourage people to stop coming here, and one of those attractants is the very thing that brings them here in the first place, which is the beaches. So you have my support. For my sake, we're going to do what we need to do. I appreciate all the efforts, and hopefully when this is all over, we can get a beer, because you've been a trooper. There's been no stopping for you every single day, and I get it, and it doesn't look like there's an end in sight, but I appreciate you. I appreciate all of your team and how hard they've worked, because there is a certain amount of cheerleading that has to go into your job. It's not simply showing people the data. It's getting them to understand it. That is very, very difficult, but I think you've done a fantastic job, and I'll give you whatever support I can provide. Thanks.
Thank you. And I would just like to say that even though our private healthcare systems, operate on margins and profits, they're big corporations. And so like in hurricanes, those big corporations shift assets all over. And so they aren't, they have stockpiles, but they don't have it at every single hospital. But their plan is to move resources, to move doctors and that type of thing. But you can't do that in this situation because every single hospital is being impacted. There is nowhere to turn. Everybody's reserves are being deployed, and they went first to those who had this first. And that's my big fear for our community, is that if we don't take drastic action now with social distancing, we'll get to a place where everybody says, sorry, Dr. Chapman, we don't have anything to send you. And that's going to be a difficult message for the community to swallow.
For sure.
versus maybe swallowing more extreme social distancing.
Mr. Morgan?
Yeah, thank you, Dr. Chapman. You're not a lawyer, but in your professional opinion, medical opinion, do you think it's best if we close all of our beaches as opposed to just our public beach accesses?
Well, you know, it's my job to give you the information you need to make those tough decisions. We need to reduce social interaction. Period. I mean, we need to reduce social interaction. This virus couldn't come at a worse time for us because it's spring break. You know, yes, I didn't bring the map today. We could certainly, if someone can, well, there's a map that shows the drive-from markets, that type of stuff. What I need to tell you is, be very clear. I don't want us to get to a place where the whole county has to shut down. And the governor may do that to us eventually too, but we need desperately to reduce social interaction, any kind of large group getting together. That 10 is really 10 people you know really well.
Yeah, sure. So I think it's a bit frustrating that the state legislature spends all session trying to strip us of home rule. And then when an emergency and a crisis comes, they're depending on a 32-year-old that sells sandwiches and tacos for a living to make these kinds of decisions. So I wish we would see him take a little bit more of a lead.
Well, you all are in a position that I am not in to advocate for your
sure.
communities to elected officials.
The problem we have is we have this asinine public versus private beach issue in Destin. And by us taking this action, I mean, it's largely symbolic, and it's going to achieve Mr. Destin's goal and my goal, and I think the goal of everyone up here, of decreasing tourism and discouraging people from gathering in massive groups while we're dealing with this crisis. But it is largely symbolic because the city of Destin over the years has done very little to address the beach issue, and we have no public beach, very little. So,
but I would say to you, the people in Atlanta don't know that. The people in Louisiana
yeah,
don't
I don't
know
think
that.
a family from...
And so when WSB in Atlanta, who caused a crisis for us a few years ago by saying Okaloosa County has flesh-eating bacteria in their water, when it was the enterococci bacteria that we measure all the time because they don't understand it. When WSB in Atlanta says the beaches are closed in Okaloosa County in the city of Destin, they're not going to know that. All right? The owners of the properties will, but it is a very powerful message. And I understand your political dilemma, but take every action you can and use this information, because I, as a state employee, can't go to legislators. You know, I can't go to them and advocate. I can't do that. You can advocate. Thank you to whoever found that for me.
So I would say that I certainly agree with everything you said, and I do appreciate you coming. But I think sometimes our attorneys will tell us that, you know, legally, you know, we're limited on what we can do with private beach, but I think that there is a right thing to do, and sometimes there's a legal thing to do, and sometimes I think laws are certainly wrong, and it's what I've always thought.
I'll tell you my opinion. As a public health professional who has to deal with public health lawyers all the time, I say to them, you're here to give me your counsel. I have to make the right decision for the health of the public. And so, lawyers are counselors to us. They don't make our decisions for us. Thank you.
Anything further? I have one follow-up question, and clearly what we know so far is that this did mutate from a bat or an animal of some sort. Is there any evidence that you've seen of it being transmitted from humans to our family pet, for example, at this point?
You know, I haven't had a lot of time to do research on that. I do know that there's guidelines on the CDC, and they're recommending that as much as we love to have our pets kiss us, that if you're sick with COVID-19, don't let your pets kiss you. We generally, viruses between, like dogs have their own influenza vaccine. Dog influenza doesn't infect us. Will this virus infect them? You know, too soon to tell. We do know the earlier studies I saw spoke to the fact that there was maybe contamination of the dog's mouth because of the licking and kissing that dogs do with their owners, either on their hands or on their face and that type of thing. So, you know, with this one, what we're advising to people is love your dog, just don't let your dog kiss you.
I know that sounded like a rather inane question, but, you know, especially when
We
we're
love
all
our
isolated with our
dogs.
family pets, and it's something that was asked, so I wanted to be sure and ask you as well. Staff, do you all have any questions you'd like to ask Dr. Chapman?
I'd like to pose one question to you. I'm not going to talk about the beaches, but I am going to talk about the other parks in the city. If we're trying to stay confined to our homes, it's a challenge to me to close off some of our other parks where we say have walking tracks, because some of the things I think you mentioned maybe yesterday in your discussion was we have to take care of our mental health and our physical health while we're going through all of this. And one thing people could do is go out for walks and things like that. So I'm in a quandary as to if we should shut down our neighborhood parks that have amenities like our walking tracks and things where our local people could still get out, take advantage of the fresh air, get some exercise, which is all good for us. And I don't know if you can offer an opinion on that or not. I know the National Parks and Recreation Association is bouncing it back and forth right now.
So I would again say to you, you're going to have to balance how do you manage it, i.e. allowing people to come in and walk. And, you know, that's what initially was allowed in California, and that's no longer even allowed. But I would encourage you to think about things like any events that get sponsored or travel leagues that want to come and use your facilities because schools are closed or other parks. I know the county is also, the question came up about the non-beach front and the bay front and other recreational areas, and they're going to start discussing that on Tuesday morning now that they're going to weekly meetings to address issues related to this. Again, if you have a way that you can manage it, where you can limit the number of people coming into a park or put up signage. I mean, right now, but to encourage group activities in the park, I would caution against that.
And you know, you made me think of one other thing. We have a fairly large swimming community, and they use the local pool. I was a swimmer myself, and I always think of, chlorine kills everything, and is there any truth to that? And would that type of a swimming pool, would that be an okay place?
Well, again, you know, I don't know. I haven't seen chlorine on the list that kills emerging pathogens, and so I'd have to look it up, and particularly in concentration. But what I would say on that is, even if it did, what you don't want is groups of people congregating in a swimming facility, in and around a swimming facility.
Okay, anything else? No. Once again, I want to thank you so much. I know how busy you are right now, and taking the time out to come here has been not only beneficial, but we are just so appreciative for your time and your knowledge. Thank you so very much.
You're welcome. You're welcome. Thank you.
Mayor Pro Tem, before we go into our discussion, would it be all right if we open it up for public comment and then rolled into our discussions?
Yeah, I was going to see if, you know, once we had sort of a briefing on what's to come, then allow public comment once they know what it is exactly that we're going to go over, if that's okay with the rest of the council. Is that okay with you as well? Fantastic. So what we have up next is just a discussion and taking through a vote and everything regarding our various procedures and policies and what we might need to change, what type of a resolution we might need to be passing. So I will turn to our attorney, and if you want to sort of introduce what we're going to be talking about, and then I can open it up to some public comment once they know what we're going to discuss. And just so the public knows, I will also permit some public comment at the tail end of our meeting as well. So you'll have at least 2 opportunities to speak today. Kyle?
Thank you, Councilmember Ramswell. What you have are 3 documents today. You have Resolution 2004 and 2 operating instructions that are before you for consideration. I'd ask that you consider Resolution 2004 first. This resolution takes action that would effectively close all public beach and public beach access ways in the city of Destin. As you know, the Okaloosa County Board of County Commissioners took the identical action yesterday at the county level, but their declaration does not extend to City of Destin public beaches. The resolution further revokes all recreational permits and reservations, and it provides for certain procedures for future council meetings, procurement meetings, and other board and committee meetings. I'll turn it back over to you, Councilmember Ramswell.
Okay, so public, I will now allow you all the opportunity to speak on any of these issues if you like. I don't have any blue cards, so if you would just like to raise your hand, I'll acknowledge you, and you're welcome to come on up and speak with us. Any takers on this? Okay, I see Ms. Bell walking. Okay, Mr. Perry, she's allowing you to go ahead and go in front of her.
Claude Perry, 732 Harbor Boulevard. We all want people to be safe. We all want the elderly to be safe. Hopefully they're sheltered in place or in a controlled situation in a nursing home. I'm one of them. I certainly want to be safe, but I do think there is such a thing as economic security as well as health security. So I urge you to think hard of this dramatic situation to shutting down the beaches. I think that is the state of Georgia has elected not to close the beaches. And I guess they have some logic, some reasoning why they don't want to close the beaches, or did not elect. The governor announced yesterday he was not going to close Georgia beaches. So when you look at the map and see our cases, we're not a hot spot. We're not Los Angeles or San Francisco or Seattle or New York or Miami or New Orleans. We have a different situation, and I think judgment, balanced judgment, is proper. So I urge you not to destroy our economy, which is what is fixing to happen. This will put many people out of business, put many people unemployed, and I think that is a serious decision that you're facing. And I'm glad you're up there making this decision and not me, but it is something that y'all need to give some serious consideration to. And I urge you not to close the beaches. The people coming here, spring break, usually means college kids, I guess some high school kids, and they are the least at risk based on everything the president has said, Dr. Fauci has said, Tony Fauci, I think is his name. So I urge you, the president has passed down to the governors and down to the county has closed the county beaches, but not in the city of Destin. And that's because it needs to be decided based on the facts at hand, available to y'all. And I know it's the easiest thing, the safest thing. I understand that. That's a quick decision. And you can't just destroy people's lives, and that's what's fixing to happen.
Claude, I love you, man, and I'll take a lot of blame up here. And I have.
I can't hear you.
I love you, and I'll take a lot of blame up here, and I have for the past 4 years, but I will not take the blame of ruining this economy by the decision I'm taking today. I'm not going to take the blame or this council is going to take the blame of destroying this economy, because this is beyond our control. And we could leave the beaches open, and our economy in Destin would still be devastated. So I'll take the blame for a lot of things, man, but I'm not taking can't put this on us.
I agree that we're facing serious problems regardless of what decision you make. I agree with that. I agree that the damage is huge damage, and we know what the media will destroy us. We know that. We saw it in the BP oil spill. I mean, I could have put all the oil in the trunk of my car, and yet we were destroyed. So this is the duration of this. We don't know what the duration is, but the risk factors for the citizens of this town is based on what the cases we've already got is minimum. It's minimum, and I urge you to not to close these beaches. I think it's a mistake, and it has to be a balance here of you save lives over here and destroy them over here. I urge you to try to salvage what we've got left. Thank you.
Thank you, sir.
Mr. Perry.
Oh,
Mr. Perry.
Mr. Perry, we have a question for you, sir.
Actually, not a question. I just wanted to speak to a couple of things you said, sir. I just wanted to speak to a couple of things that you said. Okay, first of all, one thing we all agree on, this thing is changing about a minute. What we say today or this hour, it can be different later on. But what you did say about young people, that is what they said yesterday or the day before. That's not what they're saying now. Dr. Chapman spoke to that both yesterday and today. Young people now are directly impacted, or could be, number one. The other thing to keep in mind, sir, is that the things you're talking about, okay, the hot spots that you identified, New Orleans, Atlanta, that's the places that these spring breakers are coming from, coming here. The other thing we have to strongly consider is if we didn't take action, nothing's going to be easy about any of this. But the other piece is on each side of us in Walton and actually Okaloosa has closed their beaches. So if we don't take action, our beach is going to be wide open, so everybody will come to Destin. That's going to be even worse than the spring breakers because all the people will come here. Those are just some other things for consideration that we have to think about. That's all. Thank you.
I think what you're saying is that they can be a carrier. The young people can be a carrier. But
Yes,
I think that's what you're saying.
absolutely.
So I understand that, but they're not mingling with us locals. They're mingling with themselves, and I think one of the reasons we have a low number of cases is I do think fresh air and being on the beach is a healthy situation, just like fishing is a healthy situation. To shut down the fishing would be a mistake. So
Yeah, good points, Mr. Perry.
Huh?
Very good points. I appreciate you sharing your opinion and your thoughts today. Very good points. Thank
So,
you. Yeah,
Thank you.
sure, thank you. Okay, next up, public comment. Anyone else? Ms. Bell?
Marcy Bell, 3 Gulf Breeze Court. So I've been sitting back there making some notes, and some things have come up since we've started this meeting. So I'm going to try to keep it short, but please, if you'll give me the time to say the things I need to say, I'd appreciate it. So I want to start out by saying 2 days ago I made contact with then acting city manager Webb Warren, 2 days before any actions were being taken by anyone locally, at least in the citizens' eyes. 2 days ago was also when this meeting was scheduled and noticed. He politely assured me I would be seeing actions in the coming days, and I appreciate that. Thank you. I want to apologize if any of you here have personally taken anything that I have spoken online personally. My phone and messages have also been blowing up. When there is nothing coming from our city and county, I have become the voice of the citizens. As you all know, I have always and remain dedicated to the health, safety, and well-being for all the people, all the time. If I tag you, I'm not criticizing you personally. I'm bringing your attention of the citizens to your attention. If I'm criticizing you, I will speak to you directly in my post. Third, this morning as I was leaving for this meeting, CBS News had a news story about a young man from Vanderbilt University. I have screenshotted it because I wanted to make sure I could say, in my post that I made as I was sitting over there, this is what I said in my questions to anybody who wanted to read it. No one was tagged. Where were any of him and his friends when they were on spring break, February 29th through March the 8th? Were they here in our area? Did they eat in our restaurants? Did they shop beside us at our grocery stores? Did they get gas before you at one of our local gas stations? Did any of them cough or sneeze before you walked through a door or down an aisle? I'll leave that for you to take however you'd like. The next thing I'd like to speak to is who's coming tomorrow? Is it Atlanta? Which one of those large groups is coming here? Next week or the week after? How many more weeks of spring break do we have? I think it was you yesterday at the county meeting spoke to, or maybe it was Nathan Boyles, Commissioner Nathan Boyles said he had canceled his trip to Colorado because he was a prudent person who didn't go. Those are the people who don't show up here, the people who are prudent. If they're still coming, they're not the prudent travelers. I love our vacationers. I love the people who come here. I grew up here in the state of Florida. My livelihood depends on it, but this is not the time. We survived Hurricane Opal when we were closed and had nothing to provide them in 1995. We were closed after Hurricane Ivan in 2004. We had nothing to provide them. We survived. We were closed during the Deep Horizon BP oil spill. We had nothing. We had something. They weren't coming because they thought there's oil on our beaches. We survived. We will survive this. Maybe I'm a hopeless romantic, an optimist, but we will survive. I believe that. But I stand up for the citizens in saying, protect us. If you only close our public beach accesses and beaches, you are leaving our private beaches open to the condominiums and resorts in this area. They're still coming. If they have a place to stay, they're still coming. Our bars are closed. Our restaurants are opened at 50% capacity. Let us, the locals, provide We can go to those places and keep social distancing. I don't even know if I'm using the right terms anymore because there's so many of them. But I'm pleading with you to be the example for this state. Does anybody know that Governor DeSantis closed his office in the Capitol yesterday? Why? Because it was open to the public. All right, so I'll stop that one. I think the last thing that I wanted to say, no, I need to continue that. I received a text message while I was sitting over there. Sandestin is open because Walton County allowed private beaches to still be open. And I'm going to just read it to you because I could not, there is no way that I could ever regurgitate
And I'm going to
this.
point out, please continue, because I know I let Mr. Perry speak longer.
Yeah,
We
and
didn't
I'm
start the
almost done. I
timer,
have
but-
this point and then I have
Yeah.
one last point. A friend of the person who sent this to me is 42. Her son is 13. The grandmother who lives with them is in her 60s. She's on dialysis. The son and the mom went to Disney just in February. He came home days later and had a fever and a cough for 8 days. The friend asked him to be tested at the time, but it was only international travel that they were testing. The fever went away shortly thereafter. The schools were closed. He's been home with his mom and has been, I apologize, and the grandmother, I believe, has been hospitalized. This will be, last night was her third time. So jumping to where I'm going with this is at Sandestin Beach Resort, where this is happening. The last thing is this was the message that she received from the mother, the middle generation there. 8 units of blood and 2 units of plasma later, she's stable in ICU standards. We were informed last night that even blood transfusions wear on your heart, and she will need an upper and lower endoscopy today, which will also put a strain on her heart, a heart that only works at 30% capacity on its best days. She signed a DNR order last night. I am devastated. I don't want her to suffer, and at the same time, I don't want to lose my mom. Not now. My heart is broken. The last thing I have to say is the Blue Door is the only organization here that is helping the homeless. And I would like to also read one quick item from there. What are the city's plans for our citizens, both families and homeless, when most services have closed down? Food pantries are closed. The Blue Door in Destin that serves the homeless and families is open and needs your help at this difficult time. We do food pantry, clothing, and showers. What can we get at this time? Many of the homeless have lost their jobs, and the families that rely on us are struggling. Can you help with food donations and bus passes at this point? Our sincere thanks, the Blue Door Ministry.
Thanks for sharing.
And with that, I close. I hope that nothing that I have said has fallen on deaf ears, and I appreciate each and every one of you in the room. Everyone in the room.
Thank you. Further comment from anyone in the public? Yes, sir, come on up.
Ed Rogers, 500 Harbor Boulevard, here in Destin. If you close the beaches, I don't know if it's the right answer or the wrong answer. It's a tough deal for you guys. And I feel better talking to this group than I did yesterday at the county commission, because you guys, most of you have jobs and work for a living. I saw Rodney getting in his work truck a couple days ago outside of Callahan's, and we got restaurateurs and other people that have businesses, so they understand the impact of this is going to be a lot harder on us financially and on the business community than it is going to be for the health of our citizens. I mean, that's going to be a fact. I can tell you, if you didn't close the beaches down, it's not going to matter. I own 2 condos. We had $17,000 of cancellations in 3 days. I've had over $50,000 of cancellations in my boat rental business, most of them in April. I don't have a single rental in April. I don't have a single condo rental in April. And I was almost completely booked before this week. So I know we had some kids in town this week. There was some business, but when the president said don't travel on Tuesday, they all started canceling. So, and there's nothing you guys can do to fix that. I mean, there's nothing. We're going to be hit, and But I did want to get up and say something about it because I just want you to keep us in mind. You know, I'm not going to make any money this year, or well, maybe if we find a fix before May. But I've talked to a couple of my colleagues, and what we care about are keeping our employees, because I can't just lay my people off because they can't leave me and go get a job at Dewey's, you know, or at the local market, because they're going to be shut down too. I mean, we're a service industry, and everybody is nobody's going to make any money. And so just keep us in mind. And you know, there's things like we pay some library fees, and down the road, looks like maybe we're not going to do any business this year. I'm probably going to come back and ask you guys to give us that money back, even though it's a little bit. My goal right now is to keep my people working. And I've been told there's some relief for us. I can apply for a $50,000 loan. You know, I can take a loan out so I can keep my people working, and that's probably what I'm going to do, because I've got a responsibility to them, and most other business owners feel the same way. We don't want to lay our people off, because where are they going to go? What are they going to do? I pay all the health care costs for my employees. So we have this crisis that none of us can do anything about. I lay my people off, and now they don't have health insurance. You know, it's and again, it's not something you guys can necessarily fix, but I just felt like it needed to be said. So, and again, most of you that have businesses know this anyway. Thank you.
Thank you, sir.
Mr. Rogers. I just want to, I'm going to discuss this later on in the meeting, but I want to let you know, I talked to the deputy city manager yesterday, and I'm going to ask the staff later on to look into what we can do about looking at Triumph funds to possibly impact some of the economic issues we're going to have. So we're going to address, I'm going to bring that up later, but that may help you and all the other businesses that are affected. So that will be discussed later on.
You know, our fee is based on how much equipment we have. So I'm small. Again, my fee is $1,400, but you know, the bigger guys have more employees, and so just that alone would help us a little bit. You know, we're just gonna, for me, and even my wife's a dentist. We're just trying to scrape to see what can we do to keep our people afloat until May, and hopefully come May, you know, there's some relief for all of us, and we can get people to come back and visit again. Thank you.
Thank you, sir. Anything further from any public? Okay, well, thank you all. And again, as I said earlier, there will be an opportunity for public comment at the end of the meeting. So if you think of something between now and then, you will have another opportunity. All right, so now we're going to turn back to council, and we're going to be discussing some of these policies and procedures that have been developed for us to consider as a means of addressing this situation most effectively and efficiently. Kyle, did you want to introduce the first resolution, or what is your preference for moving forward with these items?
I'd ask that council consider Resolution 2004 first. The introduction I gave prior to public comment is probably sufficient. If you have any questions, of course, we're here to answer them.
All right. City Manager, anything to add to his introduction on this?
I don't believe so. It's spelled out pretty well and is aligned with the county and the state.
Okay, terrific. All right, City Council, then I turn to you all for comment on this. And for some reason, I don't know if this isn't working or if we're just not using it, but Mr. Minchell, I saw you first.
I have a question for the city attorney. Obviously, this resolution is drafted strictly for our public beaches. Could you speak to what actions we could take if we tried to do all of our beach?
Taking action related to all of the beaches The enforceability is currently under legal review. It would possibly result in litigation. There is no law that speaks to a situation like this, so it's difficult to say at this time the enforceability of that action.
I'd like to ask our land use attorney, with your expertise on this subject, what are your thoughts on that?
I think given the circumstances and the unique nature of what's going on, it's probably an option for you. I can't guarantee the enforceability, like Kyle said, but I think if you wanted to add it to the resolution, we could, and then we could potentially call another meeting for an emergency ordinance to increase the enforceability, and maybe for now, if you chose to go that route, ask for voluntary compliance per the resolution until we get the ordinance enacted, would be one option.
Okay, thank you. And I know Chief D'Agostino is here, and correct me if I'm wrong, but I believe we technically say Destin has 6 miles of beaches minus Henderson and the private beaches. Do you, or anyone, does anyone know the amount of mileage or space, private versus our public entrances? Anyone?
If I had to guess, it'd be 90% private.
Okay, Chief D'Agostino from the back opined that it was about 90%. Yeah, if you wouldn't mind, just for the record, so it doesn't look like I'm putting words in your mouth.
Yeah, if I was to guess, Mayor Pro Tem Ramswell, I'm going to guess it's about 90%, so it would be in excess of 5 miles.
So clearly, a massive chunk of our beaches are private. Okay, thank you for that information. Mr. Minchell, back to you and your point. Did that answer your question? Do you have anything further on that?
For now.
Okay, Mr. Overdeer, I saw you next.
Well, and I think that's what our discussion has been about. The main point is that if all we're closing down is 10% of our beaches, then what effect is that going to have? If we can't close down 100%, what good is the 10%? I mean, it's like trying to put out a 3-alarm fire with a garden hose. So I'm not sure if that's the proper thing to do, but if we're going to do anything, we either need to get all in or all out.
Mr. Morgan?
Thank you, Mayor Pro Tem. I would let me preface this by saying that for the past 7 years of my life, I've worked 60, 70 hours a week to build a business and support my family. And this decision will certainly negatively impact my business. You know, and my world has been turned upside down, and the world of about 40 of my employees is going to be turned upside down. You know, 40% of Americans can't afford a $400 emergency, and my employees are about to face several $1,000 emergencies. But generally, like I said earlier, I sell tacos and sandwiches for a living, and so I'm forced to rely on the advice of experts in the medical field, in the science field, and our politicians at the highest level. And I think our decision today goes in line with what they are all strongly recommending and urging. And while I'm certainly disappointed that the governor hasn't taken more decisive action regarding our beaches, and he's leaving it piecemeal in our communities, I would move that the city of Destin close all beaches, not just our public beach accesses. And if the city of Destin doesn't have that tool in our toolbox to close all beaches, but instead are woefully inadequate public beach accesses, I would ask the city to urge Governor DeSantis to take action himself on the beaches that we find ourselves legally unable to close.
Is that a motion?
I think so, yes.
I second it.
Thank you.
Okay, we have a motion and a second. Mr. Marlar?
Kyle, Kim, how can we do it to where we imply that it would be in the best interest of the private beaches to close? Can we get away with that? I know about litigation, but I mean, let's be serious. I have my reservations about a lot of things that this virus has done, and I believe that we need to do the right thing. But if we just sort of implied in a way that it would be their best interest if we want to have the 100 days of summer, hopefully by that time, this thing will work its way through. So how would we do that?
I think the suggestion that I just made might do that. If we start the process by passing the resolution to include private and public beaches, we would ask for the private property owners to voluntarily comply at this point. We could also, you could direct staff to, per Councilmember Morgan, draft correspondence to the governor to encourage him to take further action with regard to private beaches throughout the state. And then at a future time, if you want to consider an emergency ordinance to add enforceability to the closure of all beaches in the city, then we could consider that as well.
Okay, and then so can that be tied into what our mayor's already done, but declaring a state of emergency for the city?
Yes, part of the powers that you would be exercising would be pursuant to that declaration of the state of emergency.
Okay, Mr. Morgan, if you, whatever she said, if you, I guess.
Yeah, I'm not going to incorporate the, and certainly y'all can persuade me otherwise, but I don't want to incorporate the voluntary compliance because we've seen how some of our private beach owners, I can tell you right now, it renders my motion, it neuters my motion to ask for voluntary compliance. They will not voluntarily comply because oftentimes, unfortunately, in Destin, greed rules the day. And so I would say no, and I think that if this ends up in litigation, I think it actually helps our causes and brings attention to the absurdities of our beach issues.
Mr. Destin, you look like you're ready to speak.
Yeah. Requesting people to do the right thing, we're past that point. I have seen it in our restaurants. While we have a certain diminished amount of tourism in general, we still have an onslaught of not prudent tourists who are coming here and just simply, there's just a flurry of anybody who can get a yes answer from a short-term rental or from a hotel who are saying the beaches are open and they will take their vacation. They may go, oh, well, the restaurants aren't open, but the grocery stores still will be, and we're going to come. We need to take a strong stance and say that the beaches are closed. It's the prudent thing to do under the circumstances. And it pains me greatly for all the reasons that have been mentioned today, for financial reasons, for our employees, for ourselves, for our long-term financial prosperity. It's miserable to have to take these positions. But I know in my heart that leaving private beaches open or closed to the voluntary whims of the private landowners is going to guarantee that many of them will continue to invite guests because of financial reasons, greed, whatever. And that is not in line with promoting public safety, and that is protecting our residents and protecting our most vulnerable is my job up here. And we're in a damn hell of a pickle. But I share the sentiment and will support the position of Channel Morgan.
Dr. Randall.
I would just like to say one more thing, and my comment about how greed rules the day in Destin, that's on my mind because this morning I woke up to several emails from people that are coming down here and they've scheduled vacations, and these are hard working class Americans that have saved up all year to take a beach vacation, and this has been thrown at them completely unexpectedly, and they're dealing with many short-term rental companies that aren't going to refund their vacation. And so, you know, they have to make a decision, well, do I eat $5,000, $6,000, $7,000, $8,000 and go ahead and come down here against the wishes of the people at the highest levels of our government? Or do we go ahead and come and jeopardize the safety of us, our family, our community? You know, and so that's where that comment comes from. And anyways.
Thank you, Mr. Morgan. Mr. Menschel?
Thank you. Following up on a couple of things to Mr. Destin's point about they're not going to listen. Ms. Bell just read to us what Destin just did in that particular post, in a sense that they're advertising, hey, we're open, our beaches are open. So that speaks to Mr. Destin's point. I want to emphasize a couple of things. Anything we do today is obviously not a permanent thing. We can change this 2 days from now if it dictates. This is not a permanent thing. Obviously, we hope to and pray that this thing's over much sooner than later. But I didn't give you, and I won't because of our perceived legal issues. I'm not going to talk about specific hospitals and give out their particular information except one because it was already put on the record. But I'm talking about, I said this before, our strategic plan, the number one thing in our strategic plan is our people, our residents here. So suppose your husband or your wife is sick and has to go to the hospital. Sacred Heart Hospital, okay, here has 22 ICU beds. They're all full right now, and they only have 11 ventilators in the hospital. Now that was made public, that's why I'm saying it. 11 ventilators. So like Dr. Chapman said, there's no cure right now that's just trying to aid people and keep them alive, okay? People have said, I've listened and watched all the different council meetings, both Walton County and Okaloosa, and everybody talks about what a hard decision. Yes, it is a hard decision in the sense that no matter what we do, we're not going to make everybody happy. But like Ms. Bell also said, this city has gone through lots of other crises, be it the oil spill, be it hurricanes, we've all survived. Mr. Rogers talked about his cancellations already. So in a reality, whether we close the beaches or not, you're already losing money. Closing the beaches isn't necessarily the only thing that's happening. The president's directive and all and some of that. But we've got to close the door on this. We've seen example after example how no matter what we're saying, our people aren't doing that. When Mr. Perry talks about distancing and everything else, I would also submit to you that when these kids that are coming from these hot spots, we may not be in contact with them, but when they go to Walmart and they touch things and they touch baskets and everything else that hasn't been sanitized, they may open up and sanitize, but all of our local areas, we have to do everything we can do to protect our people. And again, it's not an easy thing to do, but yet it is an easy thing to do because we have to protect our public. And the most important thing for everybody to understand, this thing will pass. We're going to work together. And the other thing I would just like to say very briefly, pay attention to your family, pay attention to your neighbors, call them, make sure they're okay. There are a lot of elderly people here that are home alone, so pay attention to that. You don't have to necessarily come in contact with them, but you can certainly reach out to them and make sure they're okay. Thank you, Mayor.
Mr. Marler?
Okay, Captain Nix is, I guess, not left already, so I'm going to address this to the city manager and to, where's he at?
In the corner.
Oh, he's hiding over there, I couldn't see him. Captain Nix, I need to address something with you. With what we're going to do here probably, and I don't think we're going to have a problem with the vote for what Chatham's asking for. How, or do you know if the sheriff and your staff, his staff and your staff have already come up with a way to enforce what we're trying to do here today? That's going to be the main issue, I guess, is how is it going to be enforced? We can say all day long we're going to close the beaches, we're going to close the restaurants, we're going to close this, but and I won't say you can't fix stupid, but I mean the tourists are not going to listen. How are we going to work this out? Other than, closing the borders, so to speak, about enforcement?
Our stance is going to be to gain self-compliance. If we can't gain compliance, then they'll be cited for failure to comply.
Okay? All right, that's about the best we can do, I guess.
Captain X? I'm sorry, I had a question for Captain X. Captain X, is it possible if you do obviously need extra manpower, can some of the school resource officers be directed to assist you?
That was the plan, but unfortunately, I guess the school system is going to be handing out equipment from their campuses for students to be able to stay home to do their schooling. So the school resource officers will remain on campus until that process is complete.
Thank you.
I had a question, and of course, now it is escaping me. Council, anything further in this regard? We
Ray,
do
could
have-
you reread the motion?
For the city of Destin to close all their beaches, and if the city does not have the legal authority to do so, to urge Governor DeSantis to take the necessary action in closing the beaches the city is legally not able to close. Sorry.
So I did think of the question that was in the back of my mind, and that is Noriega Point. What is the status of Noriega Point in terms of who has the right to make ordinances and such in that area?
Councilmember Ramsell, let me address the Noriega Point issue first. The resolution as drafted would close Noriega Point. The city has the ability to do that. As far as the motion that's on the floor, I'd ask that you amend that motion to better reflect your intent. I think if you look at Section 2 of the resolution, if you simply strike the word public from Section 2, paragraph 2, A and B, that should probably be sufficient, but...
So I would amend my motion to...
And C.
Strike the word public from A, B, and C. Sections A, B, and C.
Section 2.
Section 2.
I'm good
Okay
with the
the
second, yes.
Okay.
Absolutely.
Would that make it all, then?
I would make it all beaches within the municipal limits of Destin.
So then are you going to remove the list, or are you going to add to the list all private beaches? Because
By taking-
otherwise that leaves a loophole.
By taking out the word public, it would be intended to include both public and private, all beaches.
So the fact that private beaches isn't enumerated in the sub-items isn't an issue?
Correct, but if you want to clarify it and spell it out, there's no reason not to.
I think we might need to spell that out. I mean, what does the rest of council say? I mean, I don't want to be redundant, but nor do I want to leave a loophole. Clearly, they're conferring.
There's no reason not to. We can clarify that it covers both public and private beaches.
Okay, and going through this resolution, I did have a couple questions about some of the terminology that was used, and I know some of it was intentional and some of it was drawn from the Okaloosa County one clearly. If you go to the whereas on page 2, and it says, whereas due to universities' closings and spring break, do we want to remove universities and just put school closings, since it's clearly our local children as well as children that are not in university/college?
Sure, I mean, you can make that correction or change if you wish.
Okay, and there are a few typos. Do you want me to point them out to you later rather than?
You just give us discretion to clean up the typos. We'll read through it carefully prior to execution.
Okay, and then on page 4, at the very top, item 3, it says the lobbies of City Hall customer service, and then in parentheses, utility billing. We don't have utility billing, so doesn't that need to be struck?
That was taken out of a version that was presented to you today. The version you're discussing was on the published agenda, but we did go through it again and remove those.
Okay, terrific. All right, any further discussion on this resolution? If not, we'll go ahead and vote. Make sure that this is actually functioning, and it is. So let's go ahead and vote. And it passes unanimously. All right, I know that was a tough decision for everyone here, but it is clearly, I know we all believe, the smart and right thing to do. Mr. Benchel?
As a follow-up to that, City Manager, earlier this week, I spoke with Eglin's commander, General Kane, and I was trying to ascertain from him what was he going to do with his beaches. And basically, he told me, number one, nobody has been in contact with him, nobody from the city, nobody from the county at that point. He said that his plans were to leave the beaches open initially because they do have security, it's limited access and whatnot. But then as we continued to speak, he said, if everything else is closed down, then we're going to get slammed with people, and they're going to have trespassers and everything else. And he said, the look of perception may not be good if we leave our beaches open, if everybody else's is closed. So obviously, we don't have control over that, but I would ask you to make contact with General Kane, because I think he was just waiting for some entity to reach out to him, because at the time I spoke to him, nobody had talked to him. And the other question is, I know this is something that's going to be a work in progress, but just so it's on the record so the public will know, I'm sure our Public Works or something will come up with some signage or something for our areas. Lance, if you want to just speak to that, just so everybody's aware of it, please.
Yes, the signage that we would use to close the facilities on the beach is already in hand.
Mr. Destin, I believe you had a question.
Yes. This is a housekeeping item to a degree, but I believe Mr. Minshall probably would, I saw a Facebook post that you put up, I think last week, talking about the threat that just the practicality of exposure to the virus to our most vulnerable seniors, and how do we protect them. I don't think we have the power to coerce pharmacies and grocery stores to hold elderly-only hours at the beginning of the workday where the facilities are most clean. However, we can encourage them to do so. And if it is the pleasure of the council, I'd like to have the Mayor Pro Tem, with the help of city staff or the attorneys, draft a letter, execute it, and send it out by the end of the day to all of the pharmacies and grocery stores within the city limits, encouraging them, if they're able, to hold 65 and older only hour at the beginning of the day, so that we can at least get some of these folks relief, because we know that as this goes on, I've received, just as many of us have, flurries of text messages from folks who live out of town who are worried about their elderly parents who live in Destin. How can we help them? What can we do? And I'm going to be sort of a delivery service for friends and family and associates for people who need it, but there's people who will simply not have that, and they're going to need to go out into the maelstrom, so to speak, at which point we need to provide them with as much shelter as they can when they go to the grocery and the pharmacy. So I'd encourage you guys to support that, and hopefully we can get some compliance. I know that the Fresh Market is holding some hours in the morning for the elderly, and also I believe Winn-Dixie allegedly has started that, but I'm not 100% sure. But if we could get Target, CVS, Walgreens, some of our local folks, it may be as simple as a letter to the local manager to get this done. So appreciate it.
I support that. If you'd like to make that a motion, we can ask for a second.
Yeah, I'll make a motion that we instruct the Mayor Pro Tem to draft a letter, execute it, and have it delivered to both corporate and local management of all locations of pharmacies and grocery stores within the city limits, encouraging them to host 65 and up only hours of operation in the mornings for the benefit of our elderly and vulnerable populations to be able to shop with a certain degree of enhanced safety.
Second.
Okay, we have a first and a second. Any discussion on this further? All right, then let's go ahead and vote. and that carries unanimously. Staff, Ms. Card, I would ask too that if this is something you guys can publicize and put out on social media as well, so we can raise awareness and make sure those folks actually know what we're doing.
Absolutely. We are providing like situational reports internally. We're also putting updates on our website. So every day there will be updates for everyone to see. We'll also push it on our social media platforms to include Nextdoor. So we'll be sure to put that message out.
Excellent. I see Chief D'Agostino has walked out, but Chief Sasser, maybe you can address this question that I have. Oh, and he's back. Were your ears burning? So my question is, Chief D'Agostino, what is your plan for manning the beach at this point? Are you going to remain at your normal staffing level, or based on our decision here today, do you think you're going to drop or just wait and see? And if you could come to the podium so it's on record, please.
I know things change at every day, right? But for today, we'll be at normal staffing levels.
Terrific. Thank you. Mr. Mitchell?
Thank you. I spoke to it earlier, but I'd like to explore the thing about Triumph funds. Triumph funds were used after Hurricane Michael, and I know nobody else, to my knowledge, has addressed this in our area. I've been looking at the news and all. I just think somehow we as a city need to get in front of this and see if we can start applying for some Triumph funds to help the economic impact that it's going to have on our area. And I don't think we need a motion. I just asked the city manager and staff if they could follow up on that. I don't think we need a motion.
No, I don't think we do. They may already be familiar with it,
Right.
but not with this element. So if that's something y'all could look into, it'd be terrific.
I have a question for Lance. Mr. Johnson, do you have a general synopsis that you might be able to give to those in the business community who are in construction with regards to, or development, with regards to how they can expect the community development department, permitting, et cetera, to operate in the coming weeks?
Yes, I have an echo still, so. See if that helps. Doesn't. I'm sorry, I apologize for the echo. I don't know what's causing that. Yes, our community development, along with all the other departments, will remain functioning. The lobby areas will be closed to the public. However, individuals needing assistance from the city or permitting or things like that for the time being, if they can submit that information digitally, our staff will process it and then get with them. Hopefully they can respond digitally to it, so if they can, then that will take care of that. If they cannot, we will be scheduling in face-to-face meetings, but on a one-on-one, it has to be scheduled in advance is the bottom line, so that they could meet with staff one-on-one. So it won't be walk-ins, but we will still be taking care of business.
And actually, as a follow-up to the question that I asked Chief D'Agostino, Captain Nix, will y'all be remaining at your standard level of operation, or will y'all be increasing the number of officers that you have on patrol as a result of this situation?
We plan on keeping the spring break detail that's already funded by the TDC in place to help with enforcement for whatever we need enforcement for. It'll just depend on if we get compliance or how soon we get compliance.
Outstanding. Thank you very much. Okay, we will move on then to the next item that was part of our packet today, which is the telecommuting policy and procedure. Unless I have overlooked something, I'm seeing all sorts of looks. Is it okay to go ahead and move on to the telecommuting policy? Have we covered everything regarding beach and such?
I think we're good with the beach stuff now.
Okay. Oh, I do see a question from Mr. Braden.
Yeah, before we left it, I just want to make clarification for the public that the resolution we passed on closing the beaches was through April 30th.
But we
correct,
can
but-
rescind that if necessary, right?
Yes, this council
Or
could
extend.
meet, extend, rescind, and we have some flexibility there.
That's all. Thank you.
Okay, so moving forward, telecommuting policy and procedure. City Manager, do you want to take a stab at that?
Absolutely, thank you. The staff has provided two draft operating instructions. One is the telecommuting OI, and the second one is communicable diseases. We did provide these to the council for informational purposes, so that staff knew what we were doing and the direction we were going. We haven't needed policies similar to these, especially the communicable diseases, since I believe the year 1918 was the last time that we would have been in a position to need something like this. I was not around at that time. These administrative procedures I can create these according to the charter, so we just wanted you to be aware that we were working on them. There's some typos and things in there that we know we need to work on, and we need to update them as we get new information. But we wanted you to be aware that we are working on updating these so that we have them for this event and future similar events. I have talked to some of my counterparts around the area, and their councils have made motions that are just reinforcing that the city manager can take whatever administrative actions are necessary to protect the staff and to sustain operations of the city. So if you would entertain a motion like that.
So moved.
Thank you.
Okay, we have a motion and a second. Anything further on your end?
No, we can answer any questions if you would have questions about either one of these operating instructions.
I actually have a question for you, and that would be, have you considered, and maybe it's already implemented, but the use of Skype for business or something of that nature so that you could have a staff meeting virtually and that way continue a lot of the business of the city without everyone being in the office?
We're absolutely looking at those options right now, and Matthew, I don't know if you want to provide an additional update?
Fortunately, we do have in our Office 365 capabilities, we do have the Teams function, which has been set up. We've been working with the rest of my IT staff to put that in place, and where we can actually have independent team sessions, which allows for voice communications as well as video communications. So we do have that built in and established and ready to use if we do have to go to a teleworking policy here.
Excellent. And if, City Manager, if you could give us an idea of about how many employees we have that are hourly as opposed to salary and might be negatively impacted as a result of a reduction in hours or closing a specific office.
Yes, I'm going to let Karen Jankowski weigh in on the exact numbers for me. Do you mind doing that?
Pleasure to. Thank you so much for being here, everyone. We have probably about a third of our staff that is salary. The rest of our folks would be hourly. So within the communicable disease policy, we have benefits and compensation, as well as already our emergency operations HROI with this very similar, almost exact benefits and compensation we've used before with hurricane situations. So again, too, with legislation that may be coming down, as Dr. Chapman mentioned earlier, so I'm waiting on those, which will include potentially paid sick leave for full-time as well as part-time employees, an extension of the Family Medical Leave Act as well. So as soon as those have been signed and sealed, then we can implement those as well. We can always do more if we want than what the federal government signs, but we have to do at least the minimum of what they require. So I've been involved with a couple of online trainings, so I will make sure that I can be educated enough to deliver these to our staff.
Wonderful. I've been in that position, many years of my life. I worked part-time jobs and had no benefits at all, and when there is a disaster, you're strapped. I mean, how are you going to pay your light bill? How are you going to buy, et cetera? And I know because of the area we live in and our reliance on the economy, tourism, et cetera, we have a lot of folks that are going to be negative impacted. And anything we can do for our employees here to try to ease that transition and make it livable, I'm totally in favor of us pursuing and seeing what we can do. So thank y'all for being on top of this already, and this looks like a pretty thorough, helpful policy that y'all have in place so far. So thank you for that. Mr. Minshall.
Busy morning. I had a conversation with the city attorney, and I'd like him to speak to this so everybody else would know, but something else we're facing along those same lines. Not only do we have to look at our staff communicating with each other, it may get to the point that we have to do that. And the city attorney talked, one of the big things we'd have in that type of thing is public right to be involved and make comment. And I had that conversation with our attorney, and I'd just like him to share that so everybody's aware of that information, what's going on right now with the Attorney General.
So right now, the Municipal Attorneys Association has requested opinions from the state and the Attorney General as to how we can conduct public meetings in a safe fashion during this pandemic. To date, we haven't received any guidance. Of course, we are restrained by the Sunshine Law. So as of now, we are of the opinion that any meetings that are convened by the City Council must be done in the sunshine and allow the public to attend and comment. As far as council meetings, there is authority out there that suggests that the council also needs to have a physical quorum present, and that once that quorum is present, remaining council members could participate via telecommunications. So there could come a time where we try and implement that policy. Of course, all of this is subject to some guidance from the Municipal Attorneys Association, the state, and the Attorney General.
I know I expressed this to you on the phone, that it's very difficult for me to believe that we live in an area that is impacted by hurricanes, storms, etc. And at some point, I would assume city business has been interrupted by a hurricane, if not here, elsewhere in Florida, and everybody's dispersed upon, in various places. How is there not something in the state legislature, state statute that actually accounts for this? Like, how can we not have a teleconference and record it so that it's just unbelievable to me that in a state where we do face such emergencies that there's already nothing in place. So definitely something to pursue. Okay, anything else? All right, so you said you didn't need an official vote. You just wanted us to take a look at this and provide commentary. Is that correct?
That's correct.
And have you gotten everything you need?
Yes, we just wanted to give you all an opportunity to ask questions if you had any.
Great. Okay, so the third thing then, and you touched on this already briefly, was that communicable diseases policy. Council, anything to comment or ask about this policy? Okay, I don't see anything coming from council on this. Staff, anything? Nope. Okay, so go ahead, Mr. Moore.
I have one thing I thought about was, do we know if Okaloosa and Walton County set a hard date to reevaluate the beach closure?
The Okaloosa County declaration is consistent with the resolution this council just passed, in that it is effective March 21st through April 30th. Okay. However, at the meeting, they did leave open the possibility, like this council did, of reconvening and, of course, reconsidering should the facts change.
So we have that ability?
Yes, of course.
When we have a date?
Yeah, yes.
Anything further from the council or staff before I ask for public comments again? Okay, then we'll turn to public comments. Yes, sir, please step up.
Hello, Council. I want to thank each and every person here that is serving the city for the outstanding support that each and every one of you are doing, and we support your decision. I'm Darrell Fink, the General Manager of Jetty East, which is 500 Gulf Shore Drive, Destin, Florida. We have severely been impacted, but what you've done today helps us to begin the healing process. So it's going to be our intention that when the beaches are open, we believe that normalcy will return. One other final thing I want to mention is that we could not have had the beach sand project restoration without your help. And I want to personally thank each and every one of you for that support. I hope that you will take the time and come to Jetty East and see with your own eyes what you have helped. And it's not just us. The boat captains needed the dredging. All of Holiday Isle needed that. And what you have done has saved not only the rental impact, but also ad valorem values and sales taxes and bed taxes that we remit. So on behalf of Jetty East, I want to say thank you.
Thank you, sir. I'm glad we were able to get it accomplished. It was a long and arduous effort and took many entities, including us, the county, attorneys at multiple levels. So thank you for that. And the credit goes to a whole slew of folks. Chief Sasser, you've sat here patiently. Is there anything you'd like to say? Is that an answer?
We appreciate all that you do. We understand how difficult the decision is. Know that we're here to support you in the decision you made. We'll staff the beach as appropriate, and we'll continue to support you as we have. So that's it.
Excellent. Is there anything we can do for you all? Okay, terrific. Thank you. Ms. Bell?
Marcy Bell, 3 Gulf Breeze Court, just a few items that came across since I've been up here last. There was a suggestion that came to me about maybe making a movement of sending the visa workers home to open those job opportunities up to the locals that will now be unemployed. I don't know where these people work, but that was a suggestion that was sent to me while I was sitting over on the couch since the last time I spoke. I don't know if that's something that you guys can suggest to our local businesses.
The visa the students here on a visa.
Students, and I don't know that they're all on, I don't know. Anyways, the second thing that was sent to me was that Eglin's Beach has been closed. Is everyone aware of that? I guess they made a statement on their Facebook page. And then the last thing for the public is, when does the policy for beach closing become effective?
Saturday morning at, 1 p.m.?
It's sun up?
Sun up.
Sun up. Sun
Okay.
up tomorrow, Saturday.
Thank you. I just wanted to clarify that for the public. Thank you.
Sure. Anything else? Anyone in the public? Nope. Staff, council, last chance. Mr. Braden?
I have a question for staff. What is this executive team that I keep hearing about? Who's on it and who put it together?
It's the city manager's office, so it's myself and the deputy director are the primary members of that team, plus Lorraine, who's our administrative assistant.
And why did we put that team together?
It's always been together.
It's always been together?
Sure, yeah. The administration team is out of the city manager's office, out of the city manager's suite. So.
Okay, thank you.
Okay, if there's nothing further, I will call the meeting adjourned. Thank you all.